Welcome to this module on the Introduction to Coronavirus. The news nowadays is full of reports on coronavirus. Everyone is panicking and scared. In this scenario, being aware and creating awareness will definitely help. This course aims at providing you with a background of the coronavirus outbreak and suggesting ways to keep yourself and others safe. Coronaviruses, or COV, are the viruses belonging to a large family causing illness ranging from common cold to more severe diseases. These diseases include Middle East Respiratory Syndrome, or MERS-CoV, and Severe Acute Respiratory Syndrome, or SARS-CoV. Let's now learn about novel coronavirus. A novel coronavirus, or nCoV, has been identified as a new strain that has not been previously identified in humans. However, an outbreak of unusual respiratory condition was first reported in Wuhan, China, due to the infection caused by novel coronavirus, now known as COVID-19. Now that we have learned about novel coronavirus, let us discuss about Severe Acute Respiratory Syndrome coronavirus 2. The International Committee on Taxonomy of Viruses, or ICTV, announced Severe Acute Respiratory Syndrome coronavirus 2, or SARS-CoV-2, as the name of the new virus. It is genetically associated with the coronavirus that is responsible for the SARS outbreak of 2003. However, when related, they found both the viruses to be different. Further, on the 11th of February 2020, the World Health Organization, or WHO, announced COVID-19 as the name of this disease. Based upon the transmission rate, the WHO has declared the outbreak of COVID-19 as a global health emergency. A recent survey by the Center for Disease Control, or CDC, reports that till now COVID-19 has affected most countries and territories around the world, including one international conveyance. This was a brief intro about coronavirus. Let's recap what we have learned so far. Coronaviruses are viruses belonging to a large family causing illness ranging from the common cold to more severe diseases. One should take necessary precautions to prevent the infection spread. Welcome to the second module on coronavirus. In the previous module, we have learned about the history of coronavirus and its prevalence across the world. In this module, we will learn more in detail about the structure of coronavirus. Coronaviruses are a family of positive single-stranded RNA virus classified under nidovirals order. These viruses are enveloped and are round, and sometimes pleomorphic of approximately 80 to 120 nanometer in diameter. Let us now discuss about RNA protein. The virion contains an internal helical RNA protein nucleocapsid surrounded by an envelope made up of lipids and viral glycoproteins. These glycoproteins are spike protein, membrane protein, and small membrane. Let us discuss in detail about spike protein. The spike protein, or S, is a type 1 glycoprotein that forms the peplimers on the virion surface, giving the virus its corona or crown-like morphology in the electron microscope. The coronaviruses attach to the cell surfaces through the spike. Let us now discuss about membrane and small membrane protein. The membrane protein, or M, is highly hydrophobic and spans the membrane 3 times. On the other hand, the small membrane protein, or E, spans the membrane twice, and in some group 2 coronaviruses, an additional protein hemagglutinin esterase is present whose function is unknown. However, literature studies have shown its importance in viral entry and pathogenesis. Let us understand about the genome of coronavirus. All coronavirus genomes are arranged similarly, with replicase locus encoded within 5' end and the structural proteins encoded in the 3' end of the genome. The viral replicase is a huge protein complex comprising of 16 viral subunits and plays an essential role in the coronavirus replication and transcription at the cytoplasmic membrane. Coronaviruses, or COV, are the viruses belonging to a large family, causing illness ranging from the common cold to more severe diseases. The spike protein, or S, is a type of 1-glycoprotein that forms the peplimers on the virion surface, giving the virus its corona or crown-like morphology in the electron microscope. The coronaviruses attach to the cell surfaces through the spike. Welcome to this module on modes of transmission. In the previous module, we have learned about the structure of coronavirus. This module will focus on the different modes in which coronavirus can be transmitted. Let us get started. According to the Center of Disease Control, or CDC, COVID-19 is transmitted via droplets of fomites. The main modes of transmission of coronavirus are person to person, household transmission, from contact with infected surfaces or objects. Let us learn about each of these modes one by one in detail. So how does this virus spread from person to person? COVID-19 can be transmitted between people who are in close contact with one another or within a distance of about 6 feet. The transmission is through respiratory droplets produced by the infected person when he or she sneezes or coughs. Possible inhalation into the lungs of the droplets landing in the oral cavities or noses of people in close proximity. Furthermore, as per the statistical records on the 20th of February 2020 in Shenzhen City, among 2,842 identified close contacts, 88 people, or 3%, were found to be infected with COVID-19. Let's now look at household transmission mode. Recent reports from the World Health Organization, or WHO, show that human-to-human transmission of the COVID-19 virus is mainly occurring in families, especially in China. For instance, among 344 clusters involving 1,308 cases, out of 1,836 cases reported, 78 to 85% of positive cases have occurred in families in Guangdong and Sichuan provinces, respectively. As per the WHO, a person might be susceptible to COVID-19 if he or she touches a surface or object containing the virus and then touching their own mouth, nose, or face. However, this is not the main route of transmission. We have reached the end of this module. Let us recap what we have learned so far. The main modes of transmission of coronavirus are person to person, household transmission, from contact with infected surfaces or objects. Based on the available data, it can be stated that airborne and fecal contamination rarely transmit COVID-19. Clinical presentation of COVID-19. Welcome to this module on clinical presentation of COVID-19. Before discussing the clinical presentation of COVID-19, let's look at statistical data of people affected with coronavirus. According to the Center for Disease Control, or CDC, patients above the age of 50 are more vulnerable to the attack, and persons with underlying diseases like diabetes, Parkinson's disease, and cardiovascular diseases are at high risk. As per the World Health Organization, or WHO, the median age of affected people is 51 years, with the majority of cases, that is 77.8%, aged between 30 to 69 years. Statistical data also reveals that 51.1% of the affected population are males. Let's now learn about its clinical features. The clinical features of COVID-19: decreased white blood cells, cardiovascular damage, diarrhea, fever, fatigue, coughing and sneezing, runny nose, shortness of breath, breathing difficulties, sore throat, pneumonia, severe acute respiratory syndrome, lungs inflammation and congestion, decreased kidney functions and kidney failure. Now that you have reached the end of this session, let's recall the key takeaways. According to CDC, patients above the age of 50 are more vulnerable to the attack. According to WHO, most cases, about 77.8%, are detected in the age group of 30 to 69 years. 51.1% of the affected population are males. Symptoms may appear 2 to 14 days after exposure to the virus. Diagnosis of COVID-19. Hello and welcome to this module on the differential diagnosis and diagnosis of COVID-19. Now let's learn in detail about diagnosis of COVID-19. The prime suspects for COVID-19 include patients with fever and lower respiratory tract symptoms. Geographical distribution is also an important aspect of diagnosis. The geographical distribution and recent contact with the suspected patients should also be taken into consideration. Finally, if suspected with COVID-19, infection control measures should be implemented and public health officials should be notified. Let's understand the diagnostic criteria for COVID-19. According to the CDC, diagnosis should be based on clinical and epidemiological factors. The clinical criteria for confirming the diagnosis of the severity of coronavirus is broadly categorized into 4 types: mild, moderate, severe, and critical. For the mild type, the symptoms include fever less than 38 degrees centigrade. In case of moderate type, the patient may be presented with fever, respiratory symptoms, and imaging findings of pneumonia. If the patient is affected severely with COVID-19, then any of the below mentioned findings can be observed. 1. Respiratory distress. 2. Oxygen saturation of less than 93% at rest. 3. Partial pressure of oxygen and fraction of inspired oxygen less than or equal to 300 millimeters of mercury. Patient with a rapid progression that is greater than 50% on CT imaging within 24 to 48 hours should be managed as severe. In case of critical condition, the findings can be respiratory failure, shock, and extrapulmonary organ failure. Intensive care unit is necessary. We have discussed diagnostic criteria to be followed for COVID-19. Let us now learn about the investigation methods. Respiratory material from upper and lower respiratory tract must be collected. The upper respiratory tract specimen includes nasopharyngeal or oropharyngeal swab or wash in ambulatory patients. Lower respiratory tract specimens include sputum and/or endotracheal aspirate. Other methods of collection include blood and stool. The specimens are to be collected in sterile containers and must be stored at 2 to 8 degrees centigrade. In case of delay, the specimens are frozen at -20 degrees centigrade and then shipped. We have learned about the diagnosis, diagnostic criteria, and the investigating methods for patients. Let's now look at the various laboratory investigations. Nucleic acid amplification tests, or NAAT tests, by real-time reverse transcription polymerase chain reaction, or RT-PCR, for COVID-19 to check for evidence of viral load indicating active infection. Serological testing for detecting antibodies, viral sequencing, and viral culture. Rapid collection of the specimen and testing of specimens from patients meeting the suspect case definition for COVID-19 is a priority for clinical management and outbreak control and should be guided by a laboratory expert. Now that you have reached the end of this module, let's recap the important points. The prime suspects for COVID-19 include patients with fever and lower respiratory tract symptoms. Once suspected for COVID-19, infection control measures, along with notification to the public health officials, should be implemented. Welcome to yet another module on COVID-19. In the previous module, we have learned about the diagnosis of COVID-19. In this module, we will learn about the various preventative measures of COVID-19. Let us get started. The key preventative measures are to follow good hygiene practices. Let us learn about them. Practicing frequent hand hygiene, which involves washing hands with soap and water or alcohol-based hand rub, and keeping a hand sanitizer with self. All offices should have liquid soaps, hand rubs, refilled or replaced. Follow the culture of Namaste and maintain 2 arms length or 6 feet optimally, but at least an arm's length or 3 feet from a person who is sneezing or coughing. Be aware, avoid close contact. Follow respiratory hygiene or cough etiquette. Cough or sneeze into the inside of elbow or arms, not bare hands. If using disposable tissue paper, discard appropriately and perform hand hygiene. Offer a surgical mask to a person who is coughing or sneezing. Keep the workplace clean and hygienic. Avoid eating raw or undercooked meat. Visit the doctor if you are unwell. Now that we have learned about the preventative measures, let us move on to the various government measures. Globally, preventative and control measures are being implemented rapidly. They were first initiated in Wuhan City and other critical areas of Hubei, and then in the currently affected countries. The governmental measures for prevention include 3 stages: first stage, second stage, third stage. First stage is the early stage of the outbreak. It focuses on preventing the export of cases from the affected areas, control the source of infection, block the route of transmission, and prevent the further spread of infection. Second stage, it focuses on reducing the intensity of the epidemic. Third stage, it focuses on reducing the clusters of cases, controlling the epidemic, balancing between prevention and control. Finally, let us look at the travel advice given by the Center of Disease Control, or CDC. According to the CDC, travelers are advised to refrain from traveling to China, Singapore, the Republic of Korea, Islamic Republic of Iran, and Italy. Citizens with a history of travel to these countries may be quarantined for 14 days on arrival. The WHO has developed a guidance document for the International Air Transport Association, or IATA, to provide advice to cabin crew and airport workers. We have reached the end of this module. Let us look at the key takeaways of this module. It is important to protect yourself and others. Follow the do's and don'ts listed here and stay safe. Hello and welcome to this module on case management of COVID-19. Case management of COVID-19. In this module, you will learn how to manage a patient suspected with COVID-19 infection. As per the World Health Organization, or WHO, the patients with suspected COVID-19 should be triaged at the first point of contact. The emergency treatment should be initiated based on the disease severity. Patients, household members, and caregivers should be educated about personal hygiene, basic infection prevention and control, or IPC measures, to prevent the widespread of the infection. Let's learn about the home management of patients with suspected COVID-19 infection. The management of patients suspected with COVID-19 includes the following steps. The patient should be placed in a well-ventilated room and his or her movement should be limited in the house. All the household members should reside in a different room or should maintain a distance of at least 1 meter from the sick person. The number of caregivers should be limited. Visitors should not be allowed to meet the patient until he or she recovers completely. Hand hygiene should be performed on a regular basis. If hands are not visibly dirty, an alcohol-based hand rub can be used. For visibly dirty hands, use soap and water. A medical mask should be provided to the patient to avoid the spread of infection. Caregivers should also be provided with a mask. Masks should not be touched or handled during the use and should be disposed of on a regular basis. Direct contact with body fluids must be avoided. Masks or gloves should not be reused. Use disposable glasses and plates for the patient. Daily surfaces should be disinfected. These include bedside tables, bed frames, and other furniture. Regular household soap or detergent containing 0.5% of bleach solution should be used for cleaning. Disinfect the bathroom and toilet surfaces at least once a day. The patient's clothes, bed linen, and bath and hand towels should be washed at 60 to 90 degrees centigrade and changed on regular basis. According to the Center for Disease Control or CDC, there is no specific antiviral treatment available for COVID-19. However, people with COVID-19 should be provided with supportive care to help the patients in relieving their symptoms. People with symptoms of COVID-19 should contact healthcare providers as early as possible. Furthermore, as a preventative measure, various COVID-19 vaccines are being developed across the globe. These include INO 4800, APN01, mRNA 1273, Avian Coronavirus Infection Bronchitis Virus, IBV, Recombinant Subunit, Vaxarts Coronavirus, and Coronavirus Vaccine, Moderna Therapeutics. Now that you have reached the end of this module, let's recap the key takeaways. Patients with suspected COVID-19 should be triaged at the first point of contact. The emergency treatment should be initiated based on the disease severity of the patient. Patients, household members, and caregivers should be educated about personal hygiene. Infection, prevention, and control, or IPC measures, should be implemented to prevent the widespread of the infection.